Hi, my name is Tessa Schultz, and I did my rare disease on amyloidosis. Here is a brief overview of amyloidosis before I get into the pathophysiology. Amyloidosis is a rare disease that can affect multiple organ systems. Typically, more men than women are affected by this disease, and there are only about 3,200 new cases discovered in the United States each year. Researchers have found records that have reported signs and symptoms of amyloidosis from about 300 years ago. Although it has been around for a while, only over the last 30 years have physicians actually understood the pathophysiology behind this rare disease. They're still continuing to do studies on amyloidosis to understand why this disease occurs. They understand what is going on and what is happening in the body, but they don't understand what triggers it or what causes this disease to occur. Oh, just a little point, there was actually an episode in House in which the patient had cardiac amyloidosis. So I thought that was interesting that it made into a House episode. The pathophysiology of amyloidosis. First of all, amyloid is a type of insoluble fibrous protein that develops in the body abnormally. This type of protein, amyloid, has been found to develop from 18 different inappropriately made proteins that are normally made in the body. These deformed types of protein end up being deposited into organ tissue. There are multiple types of amyloidosis, and each type is determined by the type of amyloid that is deposited. Like I was saying on the last slide, researchers are still unsure why these proteins begin to be deposited into the tissue, but they believe it's related to structural abnormalities of during the production of protein or overproduction of protein or some other external factor. So they're not really exactly sure, but they think they have a couple ideas. And these pictures are just showing, the top one is showing how that would be a protein being formed. So, it could just be, amyloid could be just developing because of an abnormality in the protein synthesis. Okay, I am going to be talking about AL amyloidosis, which is the most common type of amyloidosis today. And it is caused by pieces of antibodies called light chains being broken off and then making their way into the tissue. So this picture on the bottom left is actually a picture of an antibody, and the purple rods on either side are the light chains. So those are the pieces that are actually breaking off the antibodies and ending up into the tissue. So over time, these amyloid, these pieces of antibodies, accumulate in the organs and cause them to stiffen. And then eventually all the healthy organ cells are replaced by amyloid, and this leads to organ failure. Signs and symptoms. So as I mentioned before, amyloidosis can affect multiple organ systems. Therefore, you're going to have a wide variety of signs and symptoms. So the most common organs affected are the heart, the kidneys, the gastrointestinal tract, and the tongue. So there are just going to be a wide variety of signs and symptoms, but here are just a few that are typical of this disease. So some signs and symptoms of systemic amyloidosis include fatigue, weight loss, easy bruising, peripheral edema, and an enlarged tongue. And an enlarged tongue is a hallmark sign of amyloidosis. And so the main organs I have found that are involved in amyloidosis are the heart and kidneys. So here are some additional signs and symptoms that may be seen when amyloidosis has infected the heart or kidneys. So you'll have protein in the urine. They may have nephrotic syndrome, and some signs and symptoms associated with that syndrome is major swelling, proteinuria, shortness of breath, and dry skin. They can also develop congestive heart failure, heart murmurs, and thickening of the ventricular wall because all the healthy organ tissue or organ cells are being replaced by this stiffened, insoluble amyloid. Genetics of amyloidosis. Researchers have been able to identify a couple forms of hereditary amyloidosis. One of the most common is called familial amyloid polyneuropathy. And it is a disease that affects the TTR gene, and TTR stands for transthyretin. It is autosomal dominant, so if you're looking at a couple like in this picture, if the father's affected and the mother's unaffected, they have a 50% chance of passing this disease on to their kids, which is a pretty high rate for how rare and fatal this disease is. So you can have two tests done in order to determine if a relative has amyloidosis. They can first do a DNA test that actually looks for the disease's gene, and then they can do a blood test that detects any abnormal proteins that might be floating around and indicate active amyloidosis. They have been able to identify two other risk factors associated with amyloidosis, and those include people on dialysis and those who have chronic inflammatory diseases. Typically, people develop signs and symptoms of amyloidosis around 60 years of age. I did read an article in which a woman was diagnosed when she was 40, but most of the time it's around 60 years of age. But as many of the articles I was reading mentioned, that they can only go on the cases that they already know about to determine when the signs and symptoms manifest, and they've found it's typically around 60 years. Evaluating amyloidosis. As I mentioned earlier, with amyloidosis can come a lot of varying signs and symptoms. So many times amyloidosis goes misdiagnosed. But doctors might start by testing urine and doing blood tests, and then they'll move on to taking biopsies. Amyloidosis affects multiple organ systems, so they may have to take multiple biopsies in order to find where this disease, in what organ this disease is developing. So they'll take their biopsies and then they use a binding agent called Congo red, and it will actually cause the amyloid fibrils to turn a bright red as shown in this picture. So all those little nodules and lump-looking things are amyloid deposit into the tissue. So confirmation of amyloidosis is determined by the presence of protein deposit in tissue biopsies. Doctors will also do a free light chain blood test, and this will monitor the progression of the disease over time to determine if it's getting better or worse. Expected outcomes. Unfortunately for amyloidosis, there is no cure at this time. Like I mentioned in the first slide, they've only been really understanding the pathophysiology of amyloidosis for about 30 years. So there's still much more to learn about amyloidosis. As of now, they aren't really sure how to break down amyloidosis or how to prevent it from depositing in the organ. So that's mainly the big holdback with treating this disease or curing this disease. So because there is no cure, treatment focuses on decreasing the amount of amyloid that is continually being deposited into the organs. Newly diagnosed patients typically have around 2 years to live. As a nurse, it is our responsibility to educate and inform patients on the treatment options available at this time. They can choose to have chemotherapy, which aims at preventing that abnormal formation of cells that could be developing these amyloid fibrils. They might give patients corticosteroids, which will decrease inflammation, and they can also try stem cell transplants, which replace old damaged cells. And as the disease progresses, they can also consider organ transplants. As I mentioned in the earlier slides, there are a couple forms of hereditary amyloidosis, and knowing this, it is very important to have those patients have their relatives tested for any type of hereditary amyloidosis. The familial amyloid polyneuropathy is autosomal dominant, which means their kids have a 50% chance of developing that disease. So it is very important to encourage family members to be tested for any type of genetic amyloidosis. And by doing this, we're also emphasizing the importance of detecting this disease early. Although there is no cure at this time, it is very important that they diagnose it early because they can still try and prevent the amyloid being deposited into the tissues and causing more damage. It's also important to provide patients with information on support groups since there is such a poor prognosis with amyloidosis. Here are a couple of the websites I found that provide useful information on amyloidosis and all that they know of right now. And that's the end of my presentation. Thank you.